All right, guys, so y'all know that I've been doing a fundraiser for masks with my buddy, and I want to make sure that you guys are also not assholes and you are making yourself useful. But actually, no, all jokes aside, off camera, Julia was telling me something about...
So my middle sibling works at a hospital, and they're actually running low on supplies, and so they were actually reaching out to like local places, like local breweries, to help them make alcohol.
That's
for
crazy.
the hospital to make hand sanitizer.
So people could drink and then fucking...
No, it's not the same. Don't drink those.
As soon as I got back from Europe, that's the first thing I was looking for.
Hand sanitizer?
Alcohol?
Yeah, rubbing alcohol. Not like to drink, because you know I don't drink and shit. But it was all gone.
Yeah.
And it was like, I don't know, some bullshit chemical there. I was like, that ain't gonna do shit. Vinegar.
Yeah, so like my middle sibling reached out to me asking if I knew anyone that had a 3D printer because they were running low on masks at the hospital. And so what they did was that they sent me like a little blueprint of that 3D print design that they wanted. It's basically like a plastic band that goes like right across the forehead, and then
Oh yeah, so their ears don't get all fucked up.
so it's like around the forehead, and then they'll have
And then you get the shield.
They'll have
Is it like the dim sum cart? No, theirs is this way.
Yeah, theirs is the other way.
There's different types. There's one that like goes behind.
It goes like this, right?
Well, right now,
No. It's like a, just think of it as a visor, and then you have a clear shield, and then
like a welder.
Yeah.
I know a lot of hospitals are reaching out to people to make that exact thing, and they're advising people who especially have the hobby of 3D printing not to try to change the plans. Because you know how people are like, oh, I want to fix it to make this better. They're like, no, just take what we gave you, use this exact plan, make it so that way, because if you change one thing, all of a sudden all the other things won't fit, right? And then the bigger thing is if people can injection mold, that's way better.
Oh, that's way faster.
Yeah, because with 3D printing, you can do like one band per 3 hours.
Yeah.
Injection molding, you can do a ton. So what a lot of people are doing now is that they're taking the 3D printed thing, taking it to the injection motor, and then making a bunch at once. Yeah, so there's a bunch of people, a bunch of YouTubers even getting together and doing this kind of shit.
It's kind of crazy how when shit hits the fan, you see how people react to this. Some people, they take advantage of it, because I know like the inner workings of this whole supply chain fuckery. Like the more I get into this fundraiser, I'm learning shit, right? So like one of it is I'm being accused by some people that I'm a con, because, you know, with every fundraiser they go, you know, where's the transparency or whatever, right? But there's a lot of things that I can't really say politically, because to protect certain things, I had to do some deals behind the scenes. Like, for example, what I can't say...
That sounds dangerous.
It is dangerous. You know why?
Gangster ass shit. Right?
Is because here's the thing, people that do know, right? And people that are in the medical industry or whatever, they know that there aren't masks. And they're like, how the fuck are you getting them? Well, for one is, I had, well, not me personally, but my
Are you
buddy.
these guys where you're like, you want to buy something?
Except from like 6 feet away.
I know, right?
We had to negotiate literally with a team of retailers and ask them to stop selling it to the public.
Oh, shit.
The thing is...
And they just listened? They were just like, sure.
Well, the thing is, we're buying them retail prices, not wholesale prices, because we had to make it a win-win situation.
Right.
Because first of all, like, they're still a business, and even though hospitals need the masks, they still need to pay their employees, they still need to push like they need to be a business, right? So for us, it was like, okay, what I think common people might be like, well, they should have just gave it to the hospitals, but that's being irrational. Like, you can't really say that because everyone needs to eat. So for us, we're trying to figure out a win-win situation for everyone. So the solution we came up with was, how about we purchase it for retail prices so you guys don't lose business, and at the same time,
buy in a wholesale way.
We control, and then they'll give us a small discount because we're buying so much, but then we get to give that and control it to the first responders, like officers, like people in ICU, like, and the thing is, there's hospitals out there that are stopping operation because they don't have the gloves, the masks, whatever. And that's the crazy part. It's not just all corona related. There's people that need, you know, surgery or whatever, and they don't have supplies. So it's just a crazy fuckery. But here's the thing, the retailers are getting fucked too right now, because air cargo, they're like, damn dude, I'm gonna take advantage of this like no shipment and everything, and they're charging up the ass. So the wholesalers are getting fucked, and they have to charge more, and then the wholesalers are charging retailers more. So all along the supply chain, everyone's charging more. So it's just fucking crazy. Yeah.
It's crazy that people do that. Like they know, especially in a time like this, their first thing is how do I make money off?
Yeah, there are two kinds of people. The
That's
ones
what
that
I'm
are like,
saying.
oh yeah, we want to help people, donate whatever we can. The other ones are like, oh man, we can make so much money from this. That's
Yeah.
crazy.
Yeah, so my friend who helped print out some of the visors, it did take like 2 to 3 hours just to print one, but he said that he's able to.
fuck.
Yeah, he's able to maybe like squeeze 2 per every like 2 or 3 hours, but. Him meeting up with my middle sibling's like coworker or whatever was like really funny because they met up behind a Target parking lot where there's like no one around, and then the friend, the hospital worker pulls up next to my friend's car, and they're like 6 feet apart at all times.
Those are like my dealings. Yeah.
And so then like the guy would like go to his back seat, open the back seat, goes like back, like just like walks far away from his car, and then my friend gets out of his car, drops the plastic visor into his back seat, and then he goes back into his car, and then they both acknowledge each other of that exchange.
Yeah.
And so they did one exchange, and then when I asked him how to go, he was like, I have another drop off tomorrow, same time at the same parking lot.
I'm not even going into the hospitals. I go into the parking lot, open up my trunk,
Yeah.
and then the doctor or nurse will come out, and I'm like, take that box, bye, and that's it.
Yeah.
And then the car, and then that closes, and I don't shake hands or nothing.
This might be a stupid question, but it's just because I genuinely don't know. Why doesn't the hospital buy directly from said those
Yeah,
people?
so here's the problem. It's not the hospitals that don't have money. Hospitals have money. There's not enough supply. So even if they have the money, they can't get the supply in time. So the problem is, hospitals, they have a list of like, hosts or distributors that they can buy from, that they're certified.
like legally buy
Very
from.
specific of what you can get.
And so the thing is, like, N95s are just gone, or like whatever. So let's say like you manufacture these, right? And then so as a manufacturer, you'll sell to wholesalers. So certain wholesalers are certified to be bought from the hospital, and in the hospital they'll send in their order, and then these guys are already depleted because if all of their clients are like hospitals or whatever, right? So the whole problem started when China got sick, because then they stopped manufacturing. And when China got sick, and then the Iran and like Europe, and they got sick before us, right? So they bought up a surge of medical supplies, and then we were kind of like the last America to get sick, right? So like it was already out. So China's back on board now, and they're like, their factories are open and they're manufacturing, but there's a month or 2 delay. So that's where the problem is hospitals needed the supplies yesterday. And so what's happening is that there are wholesalers here that have supply that aren't certified, but
In theory, then what's wrong with going with the non-certified things?
well, the hospitals could get in trouble.
Yeah,
in,
so,
a time of
They're
crisis,
accepting
though.
it now, though.
well, because then it's a liability issue, right?
So the hospital's not accepting it. I'm giving it to doctors and nurses, and they're passing it out because that's different. Because
Gotcha.
there are hospitals where they're hoarding this shit, and the employees are saying like, or the nurses they're like, don't give it to them because our administrators, people are donating masks, and we get the box, and then the administrators just put it and lock away, and then they're giving these guys 1 mask a day.
Oh no.
Yeah, because they're like, we need to ration, or like these don't meet requirements.
Yeah.
So there's just so much fuckery that's going on, and it's so complicated.
Yeah, I've seen videos of like medical professionals and stuff. They'll show you how to save the mask and like reuse it safely. So
Yeah.
they'll take it off and then they put it in like a Tupperware. I mean, without the lid, and then they leave it that way so that they can like put it on again and continue to use it.
It's so much information. I feel like I'm learning so damn much about every step of the way and how fucked up our healthcare industry is. Because here's the thing, like what sucks is there are sick doctors and nurses, right? but there's not enough staff, so they have to work.
Yeah.
So
You hear about how many retirees are coming back? Thousands of people who retired are coming back, and which is crazy because they retired, so they're also in the high risk age. But you just need medical professionals.
One of our staff members, his mom tested positive for COVID, and they still make her go back into work.
Oh no.
So they might be spreading it.
They for sure are.
And especially if you're not wearing the proper protective gear. Let's say like you're supposed to switch these out after every single patient that you see, but if you're wearing one a fucking day, dude, like that's why we're just trying our best to get it from retailers. Because so here's the thing: there are wholesalers that have it, but they're not all certified. We're lucky enough that we found FDA and CE approved. So it's not the top level, but at least it's approved by like a legit,
And are you
organization.
Are you guys moving volume at the pace that the retailers are like satisfied with?
No, so this is the problem, is that we're not moving enough. So like luckily what happened is we met our first goal, which is $15,000, but in the large scale of things, like we're not moving enough. Miniso came out and they said they'll match our donations. So that's fucking cool because that's like 20,000 masks right there. We just surpassed it. We're at $20,000 right now. And then so we're gonna keep pushing the bar. But my buddy is so fucking gangster that what he ended up doing is that when the retailers started complaining, like, guys, like if we put this online right now, we can sell all of it out, right? So instead of doing that, he found it was either FEMA or one of those organizations, but he got them to buy to take a contract of 1 million masks.
Damn.
So to cover what the public would buy, he just called the government up, and so they're gonna get that, and we're still gonna be able to piggyback off of that big purchase, so we can still provide to the local hospitals.
Damn, that's amazing.
Yeah, so we fucking did it. Like, so there's so many behind the scenes shit that's like going on
That's fucking wild.
that like it's just business, and then I think at the end of the day, like we're also trying to protect the retailers too, because they have the supply and we don't want them to look bad. And at the end of the day, like, I don't know, man, it's difficult to say. It's like it's difficult to maneuver this where no one looks bad.
Damn, good job.
Yeah,
Yep.
great job.
Thank you. Link is on the bottom if you guys want to help. We still need this. I think it's like if we push it hard for a month, that's when China's supply should be here. But that's what everyone's kind of racing to.